We'll be following President Biden's expected remarks on the state of the coronavirus pandemic later on today as well. This update will come ahead of his first address to Congress set for tomorrow. This afternoon, the president will focus on the nation's ongoing vaccination efforts, as well as new guidance from the CDC for wearing masks outdoors, several other new recommendations for fully vaccinated people, and which activities they can resume are also expected to be announced. So for more on this, let's bring in CBS News senior White House correspondent Weijia Jiang. She joins us now from the White House. Weijia, what more do we know about this new guidance?
Well, a federal official tells us that the language has not been finalized, or they are in the process of finishing that up. But we do know that these updated guidelines all stem from one key factor, and that is whether somebody is vaccinated or not. So we expect to hear in particular whether doctors believe that we still need to wear masks while we are outdoors. Of course, the CDC guidance right now says that you should still wear masks, even though they might not be necessary if you're alone or with other people or with people in your own household. But as you can see in this graphic right here, studies have repeatedly shown that a very small number of infections come from outdoor transmission, which is why we are likely going to see this new guidance today. We're also expected to hear about new protocols for healthcare settings. And, the government has made really clear that they do not believe it's their role to mandate masks. But this approach seems to be offering some incentives to people to say, hey, look, if you get vaccinated and you get your shots, this is what you can do. This is what is safe for you, as opposed to if you continue to refuse. So that subtext is really important because, as we've been talking about, the major hurdle right now for the administration is trying to reverse this vaccine hesitancy that could prevent us from getting to herd immunity.
So, Weijia, speaking about that, the White House announced yesterday that it will share its stockpile of the AstraZeneca vaccine with the rest of the world once it passes an FDA safety check. What factors led to this decision? When could the first shipment start going out? And I'm particularly interested about countries that are really suffering right now, like India, for example. Right. As you know, the United States has historically helped other countries with vaccination efforts. For example, with polio, in 1988, there were at least 350,000 people in the world who still had polio. And as of 2019, it was down to below 200. That is in part due to the U.S. helping out these other countries that don't have the resources. Given the vaccine hesitancy here, given the fact that we have a stockpile of some of these vaccines, could we potentially see the U.S. taking the lead in helping struggling poor countries to mitigate their infection rates?
Well, the president has already said that that is a priority of his, even though his top one is to, of course, make sure all Americans have access to the vaccine. He certainly is very aware of this historical effort and partnership that the U.S. has given to other countries. And this announcement is important because we know that in all the number crunching that the administration has done to make sure by the end of May there will be enough supply for everyone who wants a vaccine, it does not include the AstraZeneca vaccine. This is the Pfizer, Moderna, and Johnson & Johnson that has gotten us to the point where there will be enough. And, the AstraZeneca is not even approved with an emergency use authorization in the U.S. yet. So what happens now is that they're going to expedite that process to make sure that it is safe based on U.S. standards and then send it out to other countries. The U.S. has already committed to lending shipments to Canada and Mexico. But to your point, Vlad, certainly there are so many other countries that really need some help right now. And that's why the U.S. is not only sending raw material and deploying teams to India, but they're also trying to get them vaccines there as well. And so this is something that I think we'll continue to see, especially as the U.S. Reaches its supply and demand threshold that is happening. And unfortunately, they are very clear-eyed about the fact that soon there will be more than enough to vaccinate everyone. And that, the issue now, as we've been talking about, is that people don't want the shot.
Weijia, I want to ask you about the new census data. Things are changing. Populations are shifting. In some cases, they're getting smaller. And as a result, 7 states experience very low population growth or even lost residents. And because of that, Illinois, Ohio, Pennsylvania, Michigan, West Virginia, New York, and California, they are all going to be losing at least 1 seat in the House of Representatives. So how significant is this? And just what kind of impact could it have when we look forward to the midterm elections?
Well, these shifts are significant because it's not only about the states that are losing representation, but there are states that picked some up as well. And you have North Carolina, Florida, Oregon, Montana, Colorado, and Texas, 4 of which voted last year for the former President Donald Trump. And so, you know, it is going to make a difference even in the midterm elections. But what we're really looking at now is how these states are going to redistrict. And, you know, Republicans have an advantage there as well because of the different patterns and the growth that we have seen in those states. And so it will be really fascinating. But this happens, you know, every time that, you know, there is a count, we do see some movement around, but we don't know yet exactly how it's going to impact the representation on Capitol Hill.
Let's talk about John Kerry, Weijia. He is facing calls to step down as the special envoy for climate change for the United States after he reportedly discussed Israeli military operations with Iran's foreign minister when he served as President Obama's Secretary of State. Now, in a tweet, Secretary Kerry said the allegations are unequivocally false. What are you hearing from the White House? Has there been a response so far to this?
Well, the White House press secretary, Jen Psaki, was directly asked about this during a briefing, and she shut it down immediately, saying that she was not going to comment on allegedly leaked material. And as you mentioned, Kerry himself has rejected this idea that he shared any kind of secrets, but at the same time, Republicans are pouncing and calling for him to step down. It's not only a matter, though, of these conversations. Of course, the subject matters, too. And the spokesperson for the State Department implied that, you know, even if these conversations took place, there's no evidence that Secretary Kerry was revealing any secrets. Ned Price said, "I would just make the broad point that if you go back and look at press reporting from the time, this certainly was not a secret, and governments that were involved were speaking to this publicly and on the record." And so I think that's as far as we'll see the administration go in addressing this, but really they are not paying much attention to it because, again, these are reportedly leaked tapes, and there's still a question of whether the substance would have even made a difference with regard to revealing U.S. sensitive material.
All right. Weijia Jiang for us at the White House. As always, Weijia, we thank you.
Sure.